I've had sexual trauma. How can pelvic floor physical therapy help me? What exactly do you do? Hi, welcome to our Ed Talks, little snippets of education to help you heal and feel empowered. I'm Justine Calderwood, certified birth healing practitioner and pelvic floor physical therapist. So, you may be wondering this, and you might have a little bit of fear of the unknown on what exactly pelvic floor physical therapy is. What would a physical therapist do during a treatment session? Maybe in the past you've worked with a mental health provider to process and heal through your sexual trauma. Maybe you're currently working with a mental health provider, and maybe they have suggested pelvic floor physical therapy to help you heal even more. This is a great question, and I want to help clear out some of the fear or anxiety of the unknown that you might be having at this point. So, my number one rule, I tell this to all of my patients, especially if there's a history of sexual trauma, is that my number one goal, my number one thing to start out with is to create a safe environment where you can feel supported, you can feel safety in my presence, and we build up trust. I build your trust so that we can work together. And that sense of safety that we're going for and creating that environment of safety starts with the first phone call, even with the staff that you would talk to, some of my team members. Everything that you share here at the Healing Spot with me or my staff is confidential. We have a private treatment room so that you feel safety within your treatment session. I have a sound machine outside of my room as well, so that anything that we talk about inside of the treatment room, it's not going to be overheard. It's not like you would be here in a busy gym or, um, you know, among other people that are going to hear anything that you share by talking. The next thing that we work on it really is an assessment. I'm going to look at you as a whole person. So, more than just your pelvic floor, because I know that you are a whole person. So, what I start with is an assessment externally, meaning, and with you standing, I would look at your posture, kind of how your body is positioned, and find any strain patterns that might be going on in your body. I also am going to pay attention to just your nervous system response. A lot of my patients that have had trauma have a heightened nervous system response, meaning they're stuck in fight or flight, and so they're kind of on this hyper vigilant anxiety, looking for danger all the time. Maybe not necessarily consciously, but on an unconscious or subconscious level, where they just don't feel safe because of um, the violation that has happened in the past or a period of time where the trauma was occurring. So to work on nervous system regulation, where we're going to hopefully bring you out of fight or flight response and into more of a rest and digest response, there's just certain things that I can do as far as treatment that I won't go into completely with this video. However, I do use my hands a lot, so very gently placing my hands and doing some body work directly on your body. Externally, meaning sometimes I'm around the kidneys and releasing some of that fear that the kidneys can store, or might have one hand on the back of your head and one hand underneath, say, your lower back, and just helping you feel a little compression through my hands so we can get that nervous system to calm down a little bit. Some of the other things that I look at are the way that you're breathing, any tension patterns in your body. So your breathing pattern tells me a lot too on that nervous system response. So that's one of the things that we look at. And then to expand just on feeling in and finding where those tension patterns or where your body might be prepared to run, for instance, so tightness into your hips or into your lower abdomen. Those are areas that we look at first, and I would start to work with you so that way you can again feel safer in your body to help you heal and feel calm again. Another part of pelvic floor physical therapy would be, when and if this is appropriate for you, would be to do an internal assessment of the internal pelvic floor muscles. So that would start first and foremost with consent and a lot of respect and again safety. So what I like to do is use my pelvic models to educate on, what exactly is the anatomy, what would happen, like what would we do with a pelvic assessment, and then from there, you ask questions, and I tell you exactly what we're going to do in order to check the pelvic floor muscles internally, intravaginally. So for some people, even hearing that's a possibility that may be included with pelvic floor physical therapy, that makes them really afraid. And I think it's partly because, it's a progression. It's not something that we do day one. This is a progression where it may take several visits to get to that point. And again, that's why I want to also emphasize when and if you're ready for this type of work. It all comes with respect and consent. And one of my number one rules, it is my number one rule when working with patients, is that you are always in control of your body. So if you ever need me to stop what I'm doing for any reason, or if you need me to ease up any kind of pressure that I'm putting through my hands into your body, that you're in control of that. So I think that's very, very important to know prior to doing any type of internal pelvic work. So, me personally, as a pelvic floor physical therapist, I like to educate my patients and really empower them with information. Tell them what I would like to do as far as an assessment, and then get the consent. And then while I'm doing that, I'm also all along communicating, okay, this is what I'm going to do next. Is it okay if I move here? I don't do anything sudden. And it's all, again, done with safety and that building that trust with you. We establish safe communication. Like I said earlier, let me know if I need to ease up or stop, because that's really important that you feel in control of your body again. And then the last thing that I want to talk about is just the what you're going to learn as far as tools that you can learn to help yourself, and to take care of yourself, not only while we're doing treatments together, but what you can use in the future in order to help manage any type of, say, pain that you might be experiencing or pelvic floor dysfunction. So what I mean by that is, if you are watching this video and you're thinking that you might need pelvic floor physical therapy, there probably some kind of signs or symptoms that's driving your interest in looking into pelvic floor physical therapy to help heal from sexual trauma. So it might be something like maybe pain with intercourse or pelvic pain, or you may have noticed changes in your bowel or bladder function, meaning maybe you're going too often, or you're leaking, or you don't have the control that you need, or you're not going enough. Maybe you have constipation, chronic constipation, and you're noticing these signs and symptoms. So again, you would learn tools to help manage your symptoms in between sessions, but also, things that you can carry forward through your lifetime in order to help yourself for as long as you need to. So, whether you are currently working with a mental health provider or you've worked with one in the past, and this is something that you've come across on your own, looking into pelvic floor physical therapy, or if it was recommended to you, I encourage you, if this video resonates with you and you are at a point where you really want some help to feel better, to feel calm again, and also to heal from the past and have a functioning body that works for you, reach out to us here at the Healing Spot. We would love to chat with you and help you answer any questions that you have, and book you in for a discovery session so that we can sit down, whether that's here in my office or whether you want to meet on video, and ask me any questions that are on your mind. I would like to be a source of information for you, a source of hope and safety. You can head to my website, healingspotpt.com, and pick whatever option works the best for you. Thank you for watching this Ed Talk. I'll see you on the next one.